Hello and welcome to this CPPT information event. My name is Dr. Betty Dube. Here's an outline of what I'll be reviewing in this recording. I'll go through some introductions. I'll review the frequently asked questions regarding the course, and then I'll move on to the actual course, its background, entry requirements, curriculum, and outcomes, and we will have a live Q&A session if you're joining us for that. Here's a captioning statement for anyone who's watching using the captions, just to note that they're up to 90% accurate. So just some introductions to our school. So the course is hosted at the School of Pharmacy, Applied Sciences and Public Health, and our Dean of School is Professor Susanna Walsh. And myself, my name is Dr. Betty Dube. I'm a GPHC registered pharmacist, and I'm also the course leader. I was also the course development lead for the course before we launched it in September of 2025. Here are some frequently asked questions. So why are we doing a top-up degree for pharmacy technicians? What are the entry requirements? What's the application deadline? What are the costs? Can one self-fund? What will be taught? How will that be taught? Is there a requirement to travel to Aberdeen? And how long will it take to complete the course? As well as how does one best manage with life and work activities? So in 2019, the GPHC did published some barriers and enablers to the pharmacy technician profession, and further education was identified as an enabler to progress the pharmacy technician profession. Now, in Scotland, the National Pharmacy Group Scotland, the NPTGS, was commissioned by the directors of Pharmacy Scotland to develop a progression pathway. They used the National Career Framework for Health to describe the different levels of practice that pharmacy technicians and support staff may be delivering in the future. In Scotland, this framework is used across almost all other healthcare professions. Each level is then tied up to the corresponding education level using the Scottish Credit Qualification Framework, the SCQF, that would be required for someone working at this level of practice. A knowledge gap was identified. Feedback from this 2024 consultation said it was a positive development for pharmacy support and pharmacy technicians, as well as their wider health service, and more structured education and training options are required to empower them to undertake additional roles in required specialist skills, as well as have these skills recognized and provide reassurance across the wider healthcare teams. So when we look at the RPS 2030 Developing Workforce publication, it does say that by 2030, all pharmacy technicians should have access to post-registration training and development, which enables them to practice at an advanced or expert level. Pharmacy technicians will undertake recognized accredited qualifications to underpin the frameworks to further support the development of their roles, have equal access to advanced education to support their career development, and have a role in supporting the education development of both with others within the pharmacy and other healthcare professions. Now, when we move on to the 2025 GPHC Initial Education and Training for Pharmacy Technician Consultation, this was opened from October to December of 2025. They have proposed that they should raise the level of study from an RQF level 4, equivalent to an SCQF level 7 for entry to the register for pharmacy technicians. They also are recommending that there should be an inclusion of science for anyone to undertake the training to become a registered pharmacy technicians, and digital health genomic sustainability should be added to the learning outcomes. The proposed draft standards represent a significant and necessary step toward the pharmacy technician profession and reflects the realities of modern practice and the expectations of a workforce increasingly being central to medicine's optimization, clinical service delivery, and multidisciplinary care. So this proposal does reflect the significant evolution of pharmacy technician role and aligns closely to the educational philosophy and workforce ambitions underpinning our new degree program. So just for some more background, as I mentioned earlier, there was a comparison of the initial education and training qualifications and the underpinning knowledge across healthcare professional families. And most in this family do enter to practice as the skills for health level 5 with a degree qualification. However, pharmacy technicians enter to practice at a lower level at the SCQF level 8, which is under skills for health level 4. Okay. And this, of course, this then puts them at a disadvantage even at entry level without that degree qualification. With the expanded and evolving scope of practice of pharmacists, which now will include independent prescribing, with our new pharmacist entering the register with the independent prescriber credential from this summer of 2026, some clinical aspects can be performed by another pharmacy professional with the appropriate clinical training and knowledge, and pharmacy technicians are best suited for this. Case studies document many already working in clinical roles after completing post-registration certifications. With the evolving and expanded scope of pharmacy technicians over the last 5 years, as you can see here, when there was an introduction of pharmacy technicians to administer injections during the COVID-19 pandemic, and then they could now also provide naloxone kits in pharmacy services. But then from January 2026, there has been increased responsibilities for pharmacy technicians that enable pharmacists to focus on clinical care. This will maximize the contribution of pharmacy technicians in both community and hospital settings, where they can be left delegated to provide care out with a pharmacist being on site. So, and I did mention that professional gap, but we also looked at that credentialing gap. And as you can see here, pharmacy technicians enter to practice at this SCQF level 8, while pharmacists enter to practice with an M.Pharm at SQF level 11. So there's a level 9 and 10 that was identified as a gap, and these correspond to a degree and a degree with honors. Okay. So our school is the first to offer pharmacy technicians an opportunity to attain a clinical focused and pharmacy-related degree qualification in the UK. Again, our school is the School of Pharmacy, Applied Sciences and Public Health, which already has a strong presence in the UK pharmacy education, with being one of the 2 pharmacy schools in Scotland. We already run other postgraduate online courses that include the Practice Certificate in Pharmacist Independent Prescribing, as well as these other master's programs listed here. So our course is the BSc Honours in Clinical Practice for Pharmacy Technicians. We launched our first intake in September of 2025. The first cohort is currently studying semester 2 of the 3 semesters, and in September 2026 we'll be launching stage 2, and we'll also be taking our second cohort of stage 3. So applications are currently open, and they'll be open all through mid-September of 2026. So why our course is to bridge that knowledge gap that was identified by practicing pharmacy technicians in order to increase pharmacy technicians' scope and also their contribution to the provision of patient-centered pharmaceutical care and clinical pharmacy. So this is the web page where our course is hosted, and it's currently live for you to have a look. Since the course has been launched, this web page does have all the information you need to know about the course. So as I said, applications are now open, and if you just want to also just get in touch and express your interest, then there's an email there for you to email us. So with regards to entry requirements, for the stage 2 entry requirement, which is launching this September, it should be practicing pharmacy. So it's post-registration, a practicing pharmacy technician with at least SCQF level 7 or equivalent of education. They should be working at least 14 hours in their role, and should be at least 2 to 3 years post-registration or equivalent. But however, other qualifications and work experience will be reviewed on a case-by-case by an academic team member. If you have any questions regarding this, please do email us at this email address here, admissions@rgu.ac.uk. Now for the stage 3 entry, which will be our second cohort this September, it's again practicing pharmacy technicians with it's SCQF level 8 or equivalent education, working again for at least 14 hours in their role. They should be at least 2 years post-registration or equivalent, and other health qualifications and work experience will be reviewed on a case-by-case basis. Again, if you have any questions, please do send us an email to admissions. The course structure is comprehensive professionally relevant, and it's a clinical-oriented curriculum, acknowledging the diverse skill set required to become a successful clinical pharmacy technician. Therefore, we aligned our curriculum to the 4 pillars of pharmacy practice to ensure our graduates will be well placed to secure jobs or progress in all clinical roles in pharmacy practice sectors. So I'll quickly review the 4 pillars. So the 4 pillars include clinical practice, which to provide high quality healthcare in a safe, effective, and person-centered way, facilitating learning to enable effective learning in the workplace, leadership to lead and fulfill management responsibilities, as well as evidence research and development, where to engage in projects and use evidence to inform practice and improve services. So this will be a typical schedule. The course is offered over 3 semesters. So we start with semester 1, semester 2, all through semester 3. So that's September to December, January to April, and then May all through just mid-July. So this is, I'll just put, this is the stage 2 curriculum here. And then this is the stage 3 curriculum. So it's an average of 45 credits per semester. And however, in semester 3, it's just a 30 credit module to accommodate some flexibility over the summer holidays there. So again, I thought I would quickly include the curriculum. So this is a snapshot of one of the module descriptors, and this is a module that's offered in semester 1 of the stage 3, and it's evidence-based clinical therapeutics. The aim of the modules are stated here, the learning objectives are stated, and the indicative content is summarized here. Okay. Now, when it comes to the learning, our learning is via our e-learning environment, our virtual e-learning environment, Moodle, which is innovative and supportive and fosters a culture of continuous improvement and professional development. Learning materials do include videos, links to further resources, webinars, and activities, and the content is accessible and interactive using the latest web technologies. Moodle is available to access from any location with an internet connection via PC, a lab tablet, or mobile device, allowing 24/7 synchronous or asynchronous access to learning materials. Individual and group learning also occurs, where we emphasize both individual and group learning. Students do engage in self-directed learning, allowing them to tailor their learning to their specific interests and career goals. And we also have group projects and collaborative learning activities that are integral to promoting teamwork and have diverse perspectives. So with regards to assessments, we have different assessments. We do have exams, written and oral. We also have coursework assignments. We have a portfolio submission and presentations, and these are more in the advanced stage 4 level. So we will be developing a practitioner from knowing, knows how, showing, and actually doing. So when it comes to workload, in order to structure our and foster work-life balance for adult learners, we have spread the curriculum over 3 semesters, so September to July, with a dedicated summer break in August, and there's also a dedicated Christmas break just before Christmas all through the new year. So again, delivery is weekly synchronous sessions, as well as direct independent study. So on average, our students just now have a webinar every week, and that's around 2 hours in the evening every week, and that's alternating between the modules that are being offered that semester. It's worked quite well for most of them. When it comes to support, we do have our school handbook, which has a lot of information about all the support available. But we also have the RGU digital skills support and resources. We have our online code of conduct and cybersecurity. We also have our e-learning team that does support our online learners. We also have the study skills, library, IT support, all available to our online students. And importantly, also we have the support and advice services with the 24/7 student support app. And we're moving to the team around the student approach. So our students can approach any staff member for any kind of help they may need, and they're comfortable sharing, and they will be signposted accordingly. So once qualified, the degree qualification provide advanced knowledge across the 4 pillars of practice, and graduates will then qualify for potential career progression opportunities from level 4 with an indicative title assistant practitioner to that level 5 with an indicative title of a practitioner, aligning with the rest of the healthcare professional family. So here's a quick snapshot here when we compare against the skills for health. Level 5, that's the senior pharmacy technicians, and that's the kind of qualification they'll have, and this is the role that most of them are working in after completing their own post-registration training. And then level 6 is when somebody stays with us and completes their honors degree. They will be able to have that advanced and leadership level as well as research background. So again, this is what I was just talking about. So the BSc with honors. So they'll be educated to SCQF level 10, which is equivalent to the skills for health level 6, with a potential to progress to specialist and leadership roles as listed here. Again, based on those 4 pillars of practice. Okay, and then with the BSc, they'll be educated to that SCQF level 9, equivalent to skills for health level 5, potential for competently undertake expanded clinical roles, and with the indicative title practitioner, aligning with the rest of the healthcare family. So again, the careers in clinical pharmacy include all these listed here: in community, in hospital, in primary care, in education, industry research, and also in specialist care. In regards to fees, these are the listed fees for the upcoming year. So there's the Scottish fees, there's the rest of the UK fees, and the international fees. And this program is funded under our Student Agency Awards Agency for Scotland, the SAS funding. Okay, so it does qualify under the part-time fee grant under SAS. And there's a link that is available on the website. And the course code is 0712. Okay. So why it matters, I thought I would quickly share this summary from that was published in the Scottish Pharmacist in July of 2015 at the launch of our course. So this writer wrote, pharmacy technicians are a vital part of the healthcare force. With the right clinical training, they can play an even greater role in supporting patients, managing medicines, and contributing to safer, more effective care. This new degree helps put them at an equal footing with many other healthcare professionals who are already required to hold a degree at entry to practice. So this is, again, a reporter wrote this about our course, and I thought I would share that. So just to summarize again, those frequently asked questions. So why a degree for pharmacy technicians? So it's really to bridge that identified knowledge gap, to attain a degree, and to be at par with the rest of the healthcare family. The entry requirements, as I listed before, and they're also available on the website. Application deadline will be mid-September of 2026, but we do recommend that you apply right away as soon as you know you're interested. And of course, the fees is as listed there. It's around £2,000 for the Scottish residents and around £10,000 for the rest of the UK. Yes, you can self-fund this degree. And what you'll study is all now listed on our webpage because the course has launched. You can go in and have a look. It's a very long document, but you can go and have a look at all the module descriptors, exactly what will be taught when, for you to know exactly what you are signing up for. Everything is taught online, and you do not require to come to Aberdeen during study, but yes, you would be required to come for your graduation. So our first cohort is scheduled to graduate in December of 2027. The BSc will take you, depending on your year of entry. So if you do enter stage 3, it will take you a total of 2 years to attain the BSc with honors, and if you do enter at stage 2, it will take you a total of 3 years. And with regards to managing the work-life balance, it's recommended that you engage with a content list a minimum of an average of 15 hours per week. Okay. So just to summarize, our course includes a comprehensive curriculum that covers a wide range of topics essential for advanced clinical practice, including patient-centered pharmaceutical care, clinical therapeutics, and health promotion. We use our innovative learning environment, Moodle, which is a platform that hosts the learning resources and activities, and it allows students to access the material and participate in learning activities from anywhere with an internet-enabled device. There's flexible learning designed to accommodate the needs of working professionals. The course offers fully online learning to foster that work-life balance and study, and allows students to study at their own pace and schedule, fitting their studies around work and personal commitments. And most of our live sessions also are recorded for future reference. Then our program is actually being delivered by expert staff who are academics at our School of Pharmacy, Applied Sciences and Public Health. ensuring a high quality education is delivered, and this does include several GPHC registered pharmacists, including myself. So again, to summarize, this Bachelor of Science honors top-up degree for pharmacy technicians in clinical practice for pharmacy technicians is the first of its kind in the UK, delivered fully online over 3 semesters with a total of 120 credits per annum. And this is a link to a virtual tour if you so wish to just have a look at our campus. Thank you for your time and attention. Again, applications are open. And if you have any questions, there's an email there for you to express your interest or to email us any questions. Thank you for listening. So I will stop this recording and we'll move on to the live session. Thank you.